Hi, I'm Kelli Culver, nurse practitioner at Paul General Surgery, serving Ashland and Duluth. We're now offering BOTOX at our office. It has been FDA approved in patients 18 to 65 years old for forehead lines, frown lines, and crow's feet. So that's what we're offering here at our office. There will be some screening questions when you call to schedule your procedure. The consultation and procedure are done at the same visit, so when you leave, you will have had Botox treatment. Dosing of Botox, the recommendation is about 4 units in each spot. However, I tailor that dosing to what the patient wants to keep a very natural look, maintain some movement in the forehead so you won't be frozen. Botox is low risk procedure, especially in these upper face areas. We do recommend not having Botox if you have any neuromuscular disorders such as multiple sclerosis or other autoimmune issues, and we screen for that prior. Minimal risk of bleeding, minimal risk of infection. We use very small needles. Botox can be done every 3 months. We typically do the first consult and treatment and then have you back in 2 weeks. It takes about 2 weeks for it to completely work. We do before and after photos so that you can see the effects of it. At 2 weeks, we can do a touch-up if you'd like. If not, that's great. Then we see you back in 3 months and for another treatment. And again, we can tailor the treatment to your wishes and how much movement you want. We do a consult and procedure in the same visit. So we look at the forehead lines, the frown lines, and the glabellar region, and the crow's feet. Typically, if forehead lines are wanting to be treated, it is recommended that we treat the frown lines as well, just as far as how the facial muscles work together. But we can treat as much or as little as you'd like. Again, it's all an individualized treatment as far as dosing goes. It is a cosmetic procedure, so we do not submit it to insurance. It's cash pay, and you pay at the time of the visit. It takes about an hour. If you're interested in Botox, you can call our office and speak to our receptionist. She'll ask you some screening questions and help get you scheduled. You can drive to and from. There's no dietary restrictions. We do recommend holding certain supplements or medications that can lead to excess bleeding, such as ibuprofen, mainly because we are concerned about bruising. But in general, you can take your medications. We want you to be safe, and we can adjust accordingly. So we ask that you come with a clean face, no makeup. We do use alcohol to clean the skin just for infection control purposes. And then we do ask that you bring a moisturizer along because that alcohol can be drying. After the procedure, you can expect minimal bleeding from the tiny puncture sites. Usually that's done by the time you leave the clinic. You may have a little bit of redness to each area. They're little less than 1 centimeter circular injection sites across the forehead and the frown lines and the crow's feet. Sometimes the skin can get a little bit red. Generally, after a day or so, you can't tell that you've had the treatment done. The puncture sites heal and seal up quite quickly. As far as noticing the effects of the Botox, you're not going to notice it for a couple days, up to a week even. And what you can expect to see is you can expect that you'll notice less wrinkling, and that it actually takes more effort to move the muscles as far as frowning goes or raising your eyebrows. Typical candidates for Botox are men and women. FDA has approved treatment from ages 18 to 65 years old. That's what we're focused on now. The treatments are here at the Ashland office. I've seen patients anywhere from age 25 up to early 60s. And it just depends on the treatment focus. Some people are very aware of frown lines. Some people have one particular wrinkle they don't like, that we can just use the Botox to paralyze that muscle movement to help eliminate the constant indentation in the skin with movement of that muscle. And it just eliminates the wrinkle formation in general. The injection procedure, it's a precise procedure as far as getting the Botox in the correct location to be able to disperse appropriately across the muscle. I do use a marking pencil to mark specific landmarks in order to be sure to get the Botox in the right position to avoid complications such as the Spock eyebrow or the eyelid droop, and get the maximal effect from the Botox. So those markings are put on the face, and then I inject around those to avoid, I don't inject directly in the markings, but just to the edge of them to be sure that we're in the right location, and then those markings are cleaned off after the procedure is completed. Typically it goes right into the muscle. Certain muscles are deeper than others, so you'll notice that during the frown line procedure that muscle is more directly into the belly of that muscle, right on the top of the nose between the eyebrows. In the forehead it's injected at more of an angle because the skin is so thin there. Pain with the procedure, it may sting a little bit. The needle pokes may be a little uncomfortable, generally well tolerated. Sometimes it hurts a little more in that forehead area where there's not as much skin to move as easily, but generally well tolerated procedure. We don't need any extra numbing medication or other treatments. After that first consult and treatment, we allow 2 weeks for maximal effect of the medication, and then we have you back in 2 weeks to see, are you pleased with the results? Do you want a little bit more? And we can do touch-ups as well. I lean towards starting with a lower dose to see how we do, because we can always add a little bit more at that 2-week visit. And then after the 2 weeks, then we have you back as you like. A recommendation is at least 3 months in between Botox treatments. Some people, the treatment effects can last 4 to 6 months. It's up to you and your preference. So we can always schedule a 3-month follow-up at that visit, or you can call us to set it up when you feel that you need some more. That lasts about 3 months. It depends on how fast your body metabolizes medications, but the average time frame is 3 months that we go between treatments. Some people it can last even longer, which is great, but other people are back right at that 3-month mark wanting more treatment.
I think we got.
After the procedure, you can go back to work or go back to normal day-to-day life. There are recommendations to avoid laying down for 4 hours after the procedure, avoid any exercise or activities that would cause flushing, mainly because that can metabolize the Botox a little bit faster and maybe take it to places that are not intended. Alcohol intake, it's recommended to avoid that for 48 hours as well. Otherwise, generally pretty minimally invasive procedure, doesn't interrupt your life. You can go back to work or go back to life. You can drive afterwards. People can't really tell that you've had a procedure done a day or two afterwards, just because that the medication dissipates quickly and the redness doesn't last very long.